Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about intergenerational trauma, a path to healing inherited pain. What is intergenerational trauma? Intergenerational trauma is a concept that has gained significant attention in recent years. It is the transmission of psychological and physiological effects of trauma from a person who experienced the original event to their children and grandchildren. This is often not about a memory of a specific event, but a pattern of anxiety, emotional dysregulation, and maladaptive behaviors that are passed down unconsciously. The trauma is stored in the unconscious and can manifest in our lives as unexplained depression, anxiety, phobias, or OCD. The language of trauma, core language, and unconscious themes. Inherited trauma often lies hidden in plain sight, embedded in what we call core language. This is a concept that refers to the emotionally charged words and phrases we use to describe our deepest fears and struggles. A trauma that happened to an ancestor can be passed down through these words and phrases, almost like a code, even if the original story is never told. This can be linked to four unconscious themes that interrupt our lives and cause us to relive family traumas. Number one, a break in the early bond with our mother. Number two, merging with a parent's feelings and experiences. Rejecting a parent. Identifying with a family member other than our parents. The biology of inheritance. The role of epigenetics. For decades, the transmission of trauma was viewed primarily through a psychological lens. Now, the science of epigenetics provides a concrete biological mechanism. Epigenetics is the study of how environmental and behavioral factors can cause changes in the way our genes work without changing the underlying DNA sequence. Researchers have found that extreme stress and trauma can create an epigenetic tag on a person's DNA, altering how certain genes are expressed. This tag can then be passed down to their children, making them more sensitive and reactive to stress. Studies of Holocaust survivors and their children, as well as infants born to mothers near the World Trade Center during 9/11, provide compelling evidence of this. This indicates that the body can remember a trauma and pass down the effects, even if the memory is not conscious. How trauma is transmitted, the family system. Trauma is transmitted in a family system through more than just genes. It is passed down through a cascade of behaviors, emotional responses, and communication patterns. Communication. A parent who has experienced trauma may struggle with open communication and may unconsciously express their emotions in unhealthy ways, creating an environment where feelings are suppressed. Behaviors. Children often learn behaviors by observing their parents. If a parent copes with trauma through substance abuse or emotional withdrawal, these behaviors can be unconsciously adopted by the child. Attachment. Parents who did not have the opportunity to be nurtured themselves due to trauma may have difficulty with parenting skills, leading to a disruption in the early parent-child bond. These family dynamics create a cycle of trauma that can perpetuate itself through generations. The impact, how unhealed trauma manifests. The symptoms of intergenerational trauma often mirror those of PTSD, but without the individual having a direct memory of the traumatic event. These can include unexplained anxiety and depression, pervasive feelings of sadness or worry that have no clear cause, hypervigilance, a constant state of alertness, and an exaggerated sense of danger, even in a safe environment. substance abuse, using drugs or alcohol as a way to self-medicate or emotionally numb oneself from the underlying pain. Low self-esteem, a poor self-concept and feelings of worthlessness. Unhealthy relationships, difficulty forming healthy bonds, and a tendency towards emotional distance or detachment. Physical ailments, psychosomatic disorders, chronic pain, or gastrointestinal issues. The path to healing, uncovering the story. The path to healing begins with a willingness to uncover the family stories that have been hidden. It is important to uncover hidden family secrets and untold stories to break destructive patterns. This can be a challenging process, but is the first step towards understanding the root of our symptoms. By exploring our family's origins, including historical events, we can increase our self-awareness and begin to trace the patterns and beliefs that have shaped our lives. This awareness allows us to move from a place of being controlled by the past to a place of conscious choice. The path to healing, healing and reconnection. Healing involves more than just understanding. It's about actively creating new positive experiences that can override the brain's trauma response. This includes therapy and professional support. Seeking a trauma-informed therapist is crucial. They can identify core language patterns and develop coping strategies. Talking about trauma. Talking about family traumas is one of the most important ways to prevent them from being passed down to future generations. The silence around trauma allows it to continue to have power. Conscious choices, making choices that are in alignment with our true selves, not our inherited fears. This means practicing self-care, cultivating gratitude, and building relationships based on love and respect. Creating a new legacy. The most powerful way to heal from inherited trauma is to intentionally build a new legacy of emotional health and resilience. In conclusion, intergenerational trauma is a complex but not insurmountable challenge. It is the work of a lifetime to heal from the pain of our ancestors, but it is a journey that can lead to immense freedom and peace. We must have the courage to face our histories, the willingness to heal our wounds, and the compassion to create a new legacy for ourselves and for future generations. While we may inherit a biological predisposition, we do not have to be defined by it. The journey begins with a single step: to acknowledge the trauma, to find the story, and choose to heal. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.